These are the lecture notes for Chapter 8 on the joints. Joints are also called articulations. So, let's see. And basically, a joint or an articulation is just a place where two or more bones meet. We always think about joints as being the freely movable joints, you know, like your elbow joint, your knee joint, your shoulder joint, that kind of thing. But you're going to see that there are more, other types of joints that don't have as much movement in them. But basically, you have three structural classifications of joints, either fibrous or cartilaginous or synovial. And the synovial joints are the ones that you would recognize, like the elbow joint and the knee joint. Okay, so the synovial joints are the freely movable joints, and they the structure of a synovial joint is that it's the area where the joint is, like where the two bones meet. There's a joint cavity. Joint capsule. Anyway, I'm sorry that I got distracted. Okay, so the synovial joints, anyway, they're going to be surrounded by a synovial membrane and synovial fluid, and they are freely movable. But the structural classification is synovial, and then the functional classification is diarthroses. So it's important for you to know that all diarthroses, in other words, all freely movable joints, are synovial joints. So the other two types of joints in the functional classifications, synarthroses, which are immovable, and amphiarthroses, which are slightly movable, these are classified into fibrous and cartilaginous. So you could have fibrous and cartilaginous examples of synarthroses, and you can also have fibrous and cartilaginous examples of amphiarthroses. But the diarthroses are only going to be the synovial joints, and that's going to be the joints that you're going to be the most familiar with. So let's talk about the fibrous joints first. They're called fibrous joints because they're joined by dense fibrous connective tissue. It doesn't say if it's regular or irregular, but dense fibrous connective tissue is fine. Most are immovable, but some might be immovable, meaning that they are synarthroses, but some might be amphiarthroses, and meaning they're slightly movable. The three types are sutures, syndesmoses, and gonthoses. So sutures are the skull sutures, and they are completely immovable. So they are definitely the synarthroses, the immovable joints. Okay, and I keep going back and forth between the slides just so you know, because to make sure I'm saying it right, but also to make sure that you are seeing these terms and here, you know, because it's hard. I mean, it's a lot of terminology. So again, joints are classified into structural classifications, and they're either fibrous, cartilaginous, or synovial. And they're also classified into functional classifications. So a fibrous joint can be a synarthrosis or an amphiarthrosis. All right, so the first example of a fibrous joint is a suture, and it is a synarthrosis because it's immovable. And then the second type of fibrous joint is a syndesmosis. And they give you the example of the inferior tibiofibular joint, which is where the tibia and the fibula meet. And there's not a lot of movement, but there's some. And then the interosseous membrane connecting the radius and the ulna is another example. So there's going to be either no movement or little movement in these syndesmoses. So I'm assuming that means that they can be either one. They can be either synarthrosis or amphiarthrosis. But you don't have to know. So a syndesmosis is when the bones are connected by ligaments or and here is an example where you've got the distal end of the tibia and fibula connected by a ligament. So that is a syndesmosis. And there's not going to be a lot of movement there, but there's going to be a little bit of movement. So amphiarthrosis. Then we have fibrous joints called gonthoses. And gonthoses are, the only example is the alveolar sockets for the teeth. So the teeth inside of the alveolar sockets in the maxilla and the mandible both have those. And so those are gonthoses, and the connection between the tooth and the socket is the periodontal ligament. So this is what a gonthosis looks like. It's the tooth sitting in the socket, and then this whole structure that's white and has these bands, this is the periodontal ligament that holds the tooth into the socket. So that is the gonthosis, which is a fibrous joint. Now, our cartilaginous joints are not highly movable, but they're united by cartilage rather than ligaments. And there's synchondroses and symphyses. So a synchondrosis is almost always synarthrotic, meaning immovable. Okay? When the epiphyseal plate closes and it becomes an epiphyseal line, that is a synostosis, and there's no movement there at all. Okay? The cartilage of the first rib, where it connects with the manubrium of the sternum, and there is no movement there. So you can see an epiphyseal plate, which becomes an epiphyseal line in the adult, and that is a joint between the epiphysis and diaphysis of a long bone, but it is a synchondrosis, and then where the manubrium meets with the cartilage of the first rib, that is a synchondrosis. Both of these are immovable. And then the symphysis is going to be slightly movable. So a symphysis, the cartilage in the symphysis is fibrocartilage, so a lot of times it's hyaline cartilage, but in this case it's fibrocartilage. And the examples are the intervertebral joints, which is where your spinal disc are located, your vertebral disc. So in other words, in between the vertebrae and where the vertebrae connect to each other. And then the pubic symphysis. So both of these, the joints between the vertebrae, intervertebral joints, both of these, that one and the pubic symphysis, are composed of fibrocartilage between the joints. With the pubic symphysis, when a woman goes into labor, when she's having a baby, the pubic symphysis will actually soften, and it will allow for the hips, to spread so the baby can get through the pelvis, easier. All right. Then we have the synovial joint. So didn't spend a whole lot of time on the fibrous and cartilaginous joints, and because most of your questions from chapter 8 will be about the synovial joints. Not all, but most of them will. Synovial joints are all freely movable. They're diarthrotic, freely movable joints. And basically, the way their structure works is that they separate bones with a fluid-filled joint cavity. So they have a fluid-filled joint cavity. There are 6 general features of synovial joints. So here's characteristics. Synovial joints have bursa, and some joints have more than others, but bursa is like a packet of synovial fluid that it's placed within the joint to prevent friction. Some people get bursitis, and that's when that bursa is inflamed. And then tendon sheaths are, it's an extra sheath or an extra protection around a tendon to kind of keep it from rubbing against whatever, is close to it, whether it's another bone or whether it's a bone or another, any other muscle, but the tendon sheath basically covers the tendon and gives it extra protection from friction. And then synovial joints have stability, is one of their characteristics, and some have more stability than others. And we always compare the stability of the hip joint with the shoulder joint. The hip joint has a whole lot more stability, but it's got more limited movement. So the types of movements would be another factor. There are 6 different types of movements, and I don't really get all caught up in all those either, but there's a hinge movement, and there's rotation and circumduction. So we'll look at those different types of movements. But the stability of the hip joint is a lot higher than it is for the shoulder joint. The shoulder joint sacrifices stability for movement, being able to move. The 6 general features of synovial joints are that the bones are lined at the place where the bone meets up with the other bone. They're lined with articular cartilage, which is hyaline cartilage, and that's going to cover the ends of the bones, and it prevents the crushing of the bones. It prevents bone from contacting bone, and wearing down. So it just protects the ends of the bones. Then the joint cavity or synovial cavity is filled with synovial fluid and basically lubricates the joint. Then you have the articular or joint capsule, which is 2 layers. There's a fibrous layer of dense irregular connective tissue, and then the inner synovial membrane is loose connective tissue, and that is the part that makes synovial fluid. So you have the fibrous layer on the outside, dense irregular connective tissue, and then you have the synovial membrane on the inside that is loose connective tissue, and it produces the synovial fluid that's going to lubricate the joints. So that's your joint capsule, the 2 layers of the joint capsule. The synovial fluid is viscous. That means it's thick. It's slippery. It basically contains plasma and hyaluronic acid. And the function of synovial fluid is for lubrication, for nourishment, and it does contain, it does have phagocytic cells that are part of the immune system that help remove microbes and debris from the synovial fluid. There are also reinforcing ligaments, and different joints have different amounts and types of ligaments, but joints do have ligaments. Ligaments connect bones to bone. And then every joint has nerves and blood vessels that supply that joint. This is the general structure of a synovial joint. It's not any particular bones, but it's the general structure. You can see here the joint cavity with the synovial fluid inside. You can see the synovial membrane of the joint cavity, and then outside of that is the fibrous layer. You can see the ligament is outside the joint cavity, but sometimes they're within, like within the knee, there's the cruciate ligaments, the ACL and the PCL. But anyway, that's just a typical synovial joint. And some other features that some synovial joints have and some don't, and they have different amounts of these. There's fat pads for cushioning. The knee joint definitely has those. And then there's the menisci or meniscus. Meniscus is singular and menisci is plural. But that is a triangular shaped piece of fibrocartilage that helps stabilize the joint. Bursa are bags of synovial fluid. And they help, they kind of act like a ball bearing, a lubricated ball bearing. But they do reduce friction where any structures rub together. Tendon sheaths also reduce friction. So bursa and tendon sheaths, they're not the same thing, but they're both designed to reduce friction. This is the shoulder joint. So you can see a bursa. This is called the subacromial bursa because it's below the acromion of the scapula. And you can see a tendon sheath that's wrapped around. This tendon is the tendon of the long head of the biceps brachii muscle. But anyway, it doesn't matter that it's got a wrapping around it similar to bursa, but it's just specifically wraps around a tendon. And I am going to skip some of this and just focus on the angular movements at synovial joints. Okay, angular movements are going to be things that they're going to be movements that you can relate to, and I'll try to give you examples. So when you bend your shoulder, you bend your elbow, you're flexing at the elbow joint, and then when you extend your arm out and your elbow is straight, you're extending at the elbow joint. Then hyperextension you can't do at the elbow, but you can do it. You can hyperextend like your neck. So if you bend, let's see if I can show you a picture. Yeah, okay, so flexion of the neck is when you nod you hold your head down, bend your head down. The straight up position is extension, and then when you look up to the sky, you're doing hyperextension at the neck. And you can also see at the waist, you have flexion when you bend forward like you're bowing. Extension is when you stand straight up, and then hyperextension is when you lean back like you're, what is that game that people do where they go under the bar? I can't think of it. Oh my gosh, it's actually late tonight, but you know what I'm talking about, that where they hold the bar out and you kind of walk under it with your back hyperextended. I don't know why I can't think of it, but anyway, I don't want to waste any more time. So we have flexion of the arm at the shoulder is just when you lift your arm straight out and then you put it back, it's extension, and hyperextension is when you push your arms backward, behind you. Extension at the knee is going to be when it's like this, okay? And flexion is when you bend your knee. So you can flex and extend at the knee and at the elbow. There's a couple of other movements you can do, abduction, adduction, and circumduction. So when you just have your arms straight at your sides and then you raise them, that is abduction. Abduction is moving your arm away from the median line, from the middle of your body. And adduction, I always remember ADD is the word add, and think of it as your arm is out here. Now you're adding it back to your body. Circumduction is when you draw a circle with your arm, and you can actually do it with the hip joint too, but just not as well. Rotation is like you can rotate your head. You can rotate your shoulder. It doesn't show a picture of that, but when you twist your shoulder, not when you draw a circle with your shoulder, with your arm, but when you twist your shoulder, that is rotating at the shoulder joint. Now, there are special movements. There's supination and pronation. And I find it so much easier to show the picture. So when you turn your palm down, like let's just say you take your hand and just place it flat on a tabletop, that is going to be pronation. And then if you flip it over where your palm is up, that is supination. So pronation and supination are going to be dealing with your forearm, your radius and your ulna. And opposition is when you touch your thumb to the tip of any of your other fingers. And that's only something your thumb can do, opposition of the thumb. There's dorsiflexion and plantar flexion. So when you stand on your tiptoes, that's plantar flexion. And then when you rock back on your heels, that's dorsiflexion. Inversion and eversion are also just foot movements, and I'll just show you a picture. When you invert your foot, it's like this, twist it inside, and then eversion, it's hard to do, but you just kind of put your whole entire foot, the whole side of your foot, you try to kind of push it out to the side. And then plantar flexion, tiptoes, and dorsiflexion, you're rocking back on your heels. All right. For your mandible, we have elevation and depression. And also for your jaw, we have protraction and retraction. I'm just looking to see how many slides are left because I've kind of gone over time. Yeah, I'm actually going to stop right here, and I'll start the next recording at this slide, at slide 43.